What happens if a trainee fails a workplace-based assessment?
Hi, well, thanks very much for meeting me. I wanted to talk about my trainee that I have some concerns about.
Okay, so what are the issues for you?
Well, surprisingly enough, he passed his AKT and CSA. It was only just, and I was quite surprised on that. But I do have some concerns about his performance at work, and it's very much around his behaviours, something to do with his professionalism and his attitude that I have some concerns about.
And those concerns, are you documenting them anywhere, or is it in your head as well?
Well, I've put some notes down using the e-portfolio and the education supervisor's notes, but that's really all I've put in. I wasn't quite sure where to go.
And actually, you're absolutely right. Actually, the AKT and CSA are a summative snapshot. The real power of MRCP, which is a tripod of assessments, is actually the workplace assessments, and your role as a trainer is actually essential to match that learning trajectory. But as well as that, I found Tim Norfolk's tool very helpful. Have you come across that?
No, I haven't.
So basically, Tim Norfolk's RDMP model is actually based on 4 discrete domains of the MRCP competency framework. And that relates to relationships, diagnostics, management and professionalism. And if you look at the form that we've got, you'll see that you have relationships, and then the communication, practicing holistically and working with colleagues, and then subsections, which are word pictures of each of those competencies. Mm-hmm. And you'll notice some of them are greyed out. Those are really expected at the end of training, so you wouldn't expect an XD1 to do that. But also you'll notice there's, on the first page, for example, there's an M, which means that even though it's in a relationship domain, it's also part of the management domain as well. Okay. And so what will be helpful is for you to actually fill that in, and then we can have a look at it together. Okay, so if we look at relationships, are there any areas of below expectations you've got?
Well, I've marked about explore what the patient has understood from the consultation is below expectations, and also with the working with colleagues and in teams, I've put works cooperatively with team members using the skills appropriately as below and communicates proactively with team members. I think I'm being a bit harsh there, but this is more to do with sort of attitudes within that.
And you've got some evidence around to justify that?
Well, there is, and there's some notes that I've put in the educator's notes about how much prompting he needs, so it's the proactive. He's quite a laid-back character, and I think that's part of his personality. That means that he does need a lot of reminding, a lot of pushing to get things done and achieved, and the rest of the team have noticed that as well. Okay.
And you might notice in the middle part, when you've got the positive and negative indicators there, and these are not just one-off fail bits, but it gives you an idea of where the range of behaviours are in relationships. Yeah? Yep. So if you look at the next section of diagnostics, are there any areas of concern there?
The main thing on diagnostic was about revising the hypothesis in light of additional information. And this is where he's come across a couple of times, which is why I said I was slightly surprised with the CSA. To give you an example of that he saw a patient with a cough that he started treating. The patient wasn't responding to the treatment, yet he still stayed down that route and wasn't thinking about the alternatives that it could be.
So it seems he's not making a differential diagnosis, actually he's just coming to one, and sometimes he gets the right diagnosis through Brownian motion, but actually what we need to do is do the differential. And I notice you've said doesn't address safety netting, etc. Well, if you don't make a differential diagnosis, you're unlikely to have safety netting, would you?
Yeah, no, I'd agree with that. That's a fair point.
Okay, let's go to the management part of it and then see if we've got areas there that you've got concerns.
Okay, so in terms of the main concern in this area was about his critically appraising guidelines and research evidence to inform decision making. Because he's most certainly aware of the guidelines, and I don't think he could have passed the AKT and CSA without them. But it's about actually thinking what those guidelines mean for his patient and critically appraising them.
And if he's not able to appraise them, he's then blindly following guidelines, whereas actually, if he's able to understand the guidelines, he maybe realise there are some patients you veer from the guidelines for positive reasons, would you suggest?
Yeah, so most certainly I don't think he's doing that, and as I say, I don't think that comes out in the exam, and that's my problem.
No, it doesn't, and I think that's where in workplace assessment, use of case-based discussion is very helpful to actually look at cases and see what the evidence underpins his management. So maybe what we're thinking about. Well, we'll come to action plans in a minute. We'll come to the next part of professionalism.
Okay. And I think this is where my main concerns are about sort of taking appropriate responsibility for decisions and actions and ensuring work-life balance. And normally with this, from my experience with most trainees, you normally worry that they're working too hard and they don't look after themselves and take care of themselves sort of emotionally and physically outside of work. But he's actually the reverse, which is the first time I've come across that.
So he's looking after himself?
Well, I think I'm being a bit harsh. He has lots of commitments outside of work, and I think these are pulling him away from focusing on what he needs to get done as a GP registrar and possibly subsequently as a GP.
So have you shared your gradings with the trainee?
No, I haven't.
And
yet.
that would be helpful actually, just sharing the gradings with him, showing the evidence that underpins those gradings, coming to a summary and a joint interpretation, and with a follow-up plan, action plan with deadlines. And again, what I find helpful is not just a screening tool, but use again and again to follow that trajectory and see if they're fulfilling some of those action plans.
So you suggest that we do this on a semi-regular...
I personally think so, because again, what you've done is you've broken down the competence into various smaller areas which you can then have action plans and monitor their performance.
Okay.
Would that be helpful?
That's really helpful, thanks.
Good. Thank you.
If you're a student on our postgraduate certificate course, you'll find references and suggestions for additional reading within the online resource folder.